So Zika virus is a virus that's been around for about 70 years, described and discovered in Uganda. It's in the family of what we call flaviviruses or arboviruses, very similar to the viruses that produce West Nile virus, the West Nile fever, dengue, another one called chikungunya, Japanese encephalitis. So it's really a big family of viruses. So I would say the big concern with Zika virus is really not catching it in the United States at this point in time. It certainly is having to do with travel, and it's not necessarily only Brazil. Although that's where it apparently had initiated and started, and where it was described initially. It's really been found all over South America, Central America at this point in time, and even a lot of parts of the Caribbean. As of today, my understanding is only Chile and Argentina are the only ones that have not had Zika virus, although I'm sure it'll happen considering how close proximity they are to Peru and to Brazil. Zika viruses is really in a very specific category of individuals, and that's women of childbearing, in the childbearing potential or childbearing years. If you're either trying to get pregnant or are pregnant or are going to get pregnant in the future, these are the ones at high risk, because these are the ones that, if they develop the infection while they are pregnant, are the ones that can later on their children develop malformations and deformities such as microcephaly or the small head. How long does it take for the virus to incubate before you become sick? And the answer to that is about 10 to 14 days. So one of the keys, if you do develop an illness, is where have you traveled in the last 14 days? So that becomes very important when you come back, and making sure you tell your physician, if you're sick, when was the last time you traveled outside of your original location? So really, for international travel, it's probably the key is preventing mosquito bites. So there's several different ways to prevent mosquito bites. Number one is you really should try to get a hotel with an air conditioner, which is the majority of hotels, although not all. So air conditioning will prevent, obviously, keep the windows closed, prevent, at least at nighttime, prevent bites from mosquitoes. After that, the second one is what we tell anybody here in the United States, which is wear long sleeves, which becomes kind of difficult, but we do have those new shirts when it's hot and muggy that you can wear to prevent some of the mosquito bites, and then use certainly some kind of anti-mosquito like DEET or one of those types of things to prevent mosquito bites.